Hello everybody. Myself Professor Somnath, in charge of the Poison Information and Research Center, RGKar Medical College, Kolkata. Today I'll be giving a lecture on general management of poisoning. This is the first class on toxicology. It is a long chapter, so I have divided this class into at least 3 segments to teach you about the general management. Before any chapter, it is more or less mandatory to know the definition of what we are going to learn. We can say the first objective of this lecture is to know what is poison. If you just go through your books on forensic medicine and toxicology, or even any book on toxicology or pharmacology, you will get a long description of the definition of poisoning as well as poison. There it is written, poison is a substance which can be solid, liquid or gaseous. If introduced in the living body or brought in contact with any part of the living body, will produce ill health or death. So this is a very big definition of poison. But to me, I have a very simple definition of poison. Any substance can be poison. It is only the dose that matters. Let me explain the definition that I have just now uttered in front of you. When we have fever, we take paracetamol. Usually for an adult, it is near about 500 milligram. Now it is available in a dose of 650 milligram. So we take in a single dose in that way. But if we increase the dose, say for example, if it is increased to near about 100 milligram per kilogram of the body weight, this paracetamol, which till now was acting as a medicine, becomes poisonous. So anything can be poisonous. It is only the dose that matters. Now, why I am giving you this lecture on poisoning? Because we have a contribution towards a book that has been published by the government of West Bengal, the training module on the management of snake bite and common poisons. And if you go through that book, you will find that there is a helpline number of a poison related information at RGKar Medical College. The helpline number is 1800 345 0033, and this is the helpline number of the Poison Information Center, which has now been designated as Poison Information and Research Center, that is situated in your college. And we are giving information related with any kind of poison related managements for common people as well as for the doctors. And we are trying here to give informations regarding the treatment modality as well as the first aid. As we go on, you find that this Poison Information Center has been accepted and accredited by the WHO, and we are a part of it, giving informations throughout the entire year. Now let us define poisoning. Just as you have seen, the definition of poison, the definition of poisoning is the development of dose-related adverse effects following exposure to any kind of chemicals. It can be drugs or any other xenobiotics also. So this is what we called poisoning. So we come across to the two definitions. One is poison and the second one being the poisoning. If we just look at the epidemiology, which is nothing but a part of statistics, we'll find that WHO in its yearbook on 2012, it has been written that near about 1,93,460 deaths occur in a year due to poisoning. So you can jolly well imagine the total number of cases, apart from deaths, the total number of cases that is accountable for this disease, you can say. In 2005, we have an Indian data where it states that there was near about 2,03,914 estimated cases of poisoning. So you can just understand the burden of disease. We see that in India it is the estimated cases of poisoning and not the death that WHO had reported in 2012. Now in this context, I would ask you to remember one thing. This is a very common MCQ that is often asked. What is the commonest substance that causes poisoning in India? Just think over the answer. Okay, I'll give you the answer here only. The commonest substance is organophosphorus throughout India, but if it happens that the question is in a different way, that it is coming as a what is the commonest substance in northern part of India, then it becomes a rat killer poison. So we will discuss these two common poisoning in detail in later classes, but till now do remember these two substance name for your MCQ. Now we'll be starting the classification. This classification is mostly depending upon the different etiologies of poison. At first, we classify the poisons depending upon its nature. So the first classification is corrosives, which includes the strong acids as well as the strong alkalis. So this thing that you'll have to remember that corrosives are not only the acids but also the alkalis. There are metallic salts which are also included in this classification of corrosives. They include the zinc chloride, the ferric chloride. They all causes corrosion to the tissue in contact. The second classification is known as the irritants. It can be inorganic, of which there are non-metallic irritants that include the phosphorus, iodine, chlorine, etc. It can be the metallics like arsenic, antimony and lead. It can be mechanical, powdered glass or hair, or even it can be a metallic pin also. All these are classified under poison. The organic irritants include the vegetable poisons I think you will be coming across these names in your practical classes, which includes the Abrus precatorius, the castor, croton, etc. And under this organic irritants, we classify the animal poison, especially the snake and the insect venoms. It also includes the cantharides. The next broad classification is the systemic toxins. They include the cerebral irritants, of which it can be depressants, the CNS depressants, the commonest one being the alcohol. It can be the CNS stimulants like that of the amphetamines or the caffeine that is present in coffee. It can be telluriant like dhatura, cannabis, cocaine. And the next one, we call it a spinal poison, which practically acts on the spinal cord, of which the nux vomica is very common. Peripherally acting toxins include the conium or curare. Poisons that causes cardiovascular derangement, it includes the aconite, the hydrocyanic acid, the quinine, or it can be the asphyxiants which result in the oxygen transfer between the lungs and the blood. They include the carbon monoxide, carbon dioxide, or hydrogens. Now there is another type of classification. We call it a toxicity rating. This is important for you people because there are situations where we get a number of MCQs from these type of poisoning related questions. Please see here that it has been classified into this 6 group, which starts from super toxic to practically non-toxic. It is classified on the basis of this lethal dose in an average adult. If the lethal dose is less than 5 milligram per kilogram, that means a very small amount of poison is required to cause the death of a person. We call it a super toxic. And practically non-toxic group is greater than 15 gram per kilogram. Please remember it is 15 gram, whereas the super toxic is less than 5 milligram per kilogram of the body weight. Please remember this chart because sometimes you are asked questions from this chart, especially in your entrance examination in form of MCQs. Now that we have finished classifying the poisons, we'll classify the poisonings now. There are usually 2 types of poisoning. One include the clinical one, the second one being the medico-legal one. Under clinical, we have the following types. It can be acute, it can be subacute, it can be fulminant, or it can be chronic one. Under medico-legal group, it includes accidental poisoning, which is the commonest one because most of the household poisoning as far as the children are concerned are mostly accidental. It can be the environmental poisons which are accidental also, which includes the snake bites, the wasp bites, etc. etc. The second under this group is a deliberate poisoning. It can be subdivided into suicidal poisoning and homicidal poisoning. Now let us discuss what is an acute poisoning. Acute poisoning means if a person takes a huge amount of poisonous substance in a single dose and the sign symptoms develops within a very short interval of time. So we can say that excessive single dose, or there is another way of causing acute poison where there are multiple smaller doses within a short period of time. And in chronic poisoning, the same thing, same amount of poison the person has taken over a longer period of time. Smaller doses over a long period of time, resulting in gradual worsening of symptoms. They include the arsenic, phosphorus, antimony, but these poisons, when taken in a very shorter interval of time or in very large quantity in a single dose, it can cause acute poisoning. Within these two groups is the subacute one, and fulminant is mostly severe poisoning where the person dies before the classical sign symptoms of the poisoning developing. So before any sign symptoms the person dies. It includes the fulminant type of poisoning with huge amount of poison taken over a single shot. As we have discussed the other group, we'll now discuss in a bit detail homicidal poisoning. Yes, it can occur. By definition, homicide means a killing of a human being by another human being. If it is done by administration of poisonous substance, then it is an homicidal poisoning. Suicidal poisoning, as you know, that the person is self-administrating the poison, but the problem is that as a doctor or as a forensic specialist, it is very difficult to differentiate between the suicidal and homicidal poison depending upon the post-mortem appearance, because the post-mortem appearance in both the cases resemble the sign symptoms of a poisoning and not the manner. So in order to understand what is the manner in these cases, what we do is we look for the circumstantial evidences and other type of evidences that can be collected from the scene of crime. The accidental, as we have discussed already, it is mostly related with the children as well as in the entire group of snake, wasp, bees. These poisons are mostly accidental poison. Occupational exposure of poison can occur, and I think you people are very much conversant with the people who are working in different factories and they are coming in contact with different poisonous substances. In most of the cases, these occupational poisonings are a chronic one. When the people are exposed to a specific type of allergen or poison or toxin, ultimately poisoning develops in those people, and we call it occupational poisoning due to the specific occupation for that of that person. Now, when we go back to our textbook, you will find that in most of the textbook there is a entity which is known as an ideal, homicidal and suicidal poison. It can be an ideal suicidal poison or homicidal poison. It is written something there. Believe me, this is a very favorite question for those people who has become a bit old and they believe in this specific concept of this ideal, suicidal and homicidal poison. If you go through the books, you will find that it is very clearly written there that an ideal, suicidal and homicidal poison must be having these characteristics. Firstly, it has to be cheap. The second one, easily available. The third one, highly toxic. The fourth one, it must be having a pleasant taste or it has to be tasteless. The fifth one is it can be easily taken with food or drinks and can produce painless death. There is another one or two more characteristics as far as this ideal homicidal or suicidal person is concerned that is depicted in this slide. So, in the same way, it has to be cheap, easily available, colorless, odorless, tasteless, can be administered with food or drinks. These four are very common. It is common in the earlier slides also. It has to be highly toxic, and signs and symptoms, as I had already told, that should resemble a natural disease and should be delayed. That means there must be a gap between the administration and the sign and symptoms that is appearing. And in most of the films we have seen that the patient develops signs and symptoms after going back to home, blah blah blah. Next, there should not be any antidote. This is another important characteristics. There should not be detected by post-mortem examination or chemical analysis, and must be rapidly destroyed so that it is undetectable even after a thorough post-mortem examination or any type of analytical toxicological methods. But believe me, both are myths. There is no such ideal homicidal or suicidal person. If you go through your books, you will find that under the ideal homicidal poison or suicidal one, it is written that aconite, the name of aconite, sometimes it is written the name as arsenic, being an ideal suicidal or homicidal poison. But if you go through all the characteristics that I have described in the earlier two slides, that it is cheap, easily available, etc., etc., it is not so. You cannot go to a shop and ask that amake 10 gram arsenic dite paren. I don't think that you will get it. Neither you will get an aconite root in order to cause death in that way. So there is no such poison like ideal suicidal and homicidal, but it is written in most of the book, and you people, if you are asked to give answer on this specific topic, has to be telling all these things that I have already told. But for your belief, you should understand that there is no such thing whatsoever. Now we'll be discussing another important thing, and this is the last thing for today's discussion. It includes the role of a doctor in a case of suspected poisoning. This is mostly a medico-legal duty we'll be doing with it right now. We'll be discussing with it right now. The immediate role of a registered medical practitioner is to save the life of a patient. So the immediate management is the first thing that a doctor has to be doing while a patient of poisoning comes to him. The second important thing is he has to preserve the vomitus, urine or stool, and the stomach wash samples. This is very important because we can detect the poison from these specimens. The third one is please preserve the suspected food or the bottle or the container or the paper packs, etc., which will help to identify the specific poison. This is another important thing that you must be aware of. If you have not done it, then a person, a registered medical practitioner, is punishable under section 201 IPC. Now the thing is that I would ask you a question in this regard. After you have gathered all these samples, as I have already told, what is the next thing that you people will be doing? You have collected it, it's very good, it's fine, okay. Now what is to be done? Any idea? Okay. Now let's see what a doctor should be doing it. They will be handing away all these preserved article to the police personnel for detection. But please do not forget to pack it, label it, sign it, and seal it. So all these things, as I have told, the packing, labeling, signing and sealing has to be done by the doctor, and then only you will be handing it over to the police personnel. And please remember another thing, while you are handing over these articles, please keep a receipt of those articles that you have handed over, because it may happen so that the police may deny that you have handed over those articles to him. So the receipt is very important for you people. Now we'll be discussing another important thing with respect to the patients who are coming to a hospital with history of poisoning. It is almost mandatory to inform all cases of poisoning to the police. But what you see in this slide, I have written, it is not mandatory to inform all the cases to the police. The reason is that I have written a word at the heading of this slide that this is for the private practitioner. So, for the government people, it is almost mandatory to inform all the poisoning cases, but for the private practitioners or the private hospitals, it is not mandatory to inform all the poisoning cases. When it is mandatory, if the doctor is convinced that the nature of poisoning is homicidal or suicidal, he is bound to inform to the police. There is another aspect. If the patient dies, irrespective of whether he is a private practitioner or a government one, the doctor has to inform the police in this section. Another important thing that you people must be knowing is that if a police or the court wants any information about any case of poisoning, even from the private practitioner who has not informed the police, the attending doctor has to provide it. And this is under section 175 CRPC, that he will have to inform all the informations that is being asked by the court of law. If he fails to do so, he is liable to be prosecuted under the same section 202 IPC. Now, this is what is written in most of the legal books with respect to the people who are dealing with poisoning patients, that is the doctors. My advice is that even if you are in a private hospital, please inform all the cases of poisoning to the police, whether it is an accidental one or a homicidal one or a suicidal one. Please do not differentiate it at the initial stage and try to inform it, because it may happen so that a suicidal poisoning later on can become homicidal one by the complaint of the relatives. So, as I have very clearly written, it is better to preserve all the papers and the documents as well as to inform the police. So let us stop today in this context that you people have understood the initial aspect of poisoning management. In the next class, we'll be going into the intricacy of this poisoning. Till then, thank you very much.